Hi everyone, welcome to Private Patient Advocates. I'm Ev Zervadakis and I'm here to go into detail as to how to fill out the form and the information that you're going to need to fill out the form accurately. So on the first page, and you could always pull up one of these forms from your state, you don't really need an attorney, but you could pull it up and you look up advanced directives and make sure, like this one's for Virginia because that's where I'm at. It gives you instructions on the side. So the first one is section 1, healthcare decision maker, which is called your agent. And that A is who I pick to be my agent. You fill out and you appoint the person. I appoint this person blank to be my healthcare to make my healthcare decisions for me when I cannot make the decisions for myself. So you could have your first agent's information, phone number, and all the address. You could also pick out a second one and put that information in here. It's very clear if you could read it, but that is the first section and it's on page 1. And then it says, my agent will have full power to make healthcare decisions for me based on this advanced directive. And my agent will have this power only during a time when I am not able to make informed decisions about my health care. Okay? So, and then there's another paragraph. I want my agent to follow what I have written in this directive. So make sure that if there are any blanks, that you put either NA or cross the whole thing out so no one else could write anything in there afterwards. Okay? Better to be safe than sorry. And I want my agent and healthcare providers to communicate with me and consider my views even when I am unable to make my own decisions, and the agent has the power to make decisions for me. Okay? So that's the end of page 1. That was relatively easy. Page 2 of 7 is section B, what my agent can do on my behalf. And then it lists everything. My agent will have power to consent or refuse consent, to ask for and receive and review oral or written information about healthcare decisions, to hire and fire my healthcare provider, to consent to my admission to or transfer to a hospital, hospice, nursing home, assisted living facility, or other healthcare facility. 5, to consent to my admission to or transfer to a mental health care facility when it is recommended by my healthcare provider. 6, to continue to act as my agent as long as I am unable to decide for myself, even if I state that I want to fire my agent. And 7, to consent to my participation in any healthcare study if the study offers the chance of therapeutic benefit to me. So studies and experimental drugs, you need to say, no, I don't want to be part of any experimentation. Also, you may want to throw in this document that you don't want any students, if you don't want them to be there while they're doing a procedure. That's personal preference. But if sometimes you just want the doctor to be 100% focused on you and not on teaching. Whatever you think is, whatever you want is what you need to specify here. So to consent to participation in a healthcare study, to consent to my participation in any healthcare study that aims to increase scientific understanding of a condition that I may have, or to promote health well-being, to make decisions about visitation when I am admitted to any healthcare facility. Some people choose to not have any visitors, and I've seen where the patient was unable to speak. The family chose to not allow other friends to visit the person in the hospital, so they were denied. The friends were denied visitation. So have that written in advance that your friends can come and visit. I've seen a lot of times where family members will just blanket say nobody comes to visit. So if you do want your friends to visit, you need to write that down right there, okay? Um, and the last one is to take any lawful actions needed to carry out these decisions. This may include signing releases of liability to medical providers or other healthcare forms, okay? So that's page 3. Going on to page 3, C, what my agent can do over my objection. So when you're not able to make an informed decision, you could check off 1, to consent to my admission to a mental health care facility, or number 2, to consent to other health care that is permitted by law, even if I object. So then the signature, I am a licensed physician, clinical, blah, blah, blah. Whoever that may be, the medical professional would sign that there. Then in section 2, on the bottom of page 3, you have my health care preferences and instructions. So write down as much detailed information here about what you want to see happen should you not be able to speak for yourself. Remember, these documents are your mouthpiece. So whatever's written is so. I remember working in the hospitals, we always used to say, if it's not written, it ain't so. So make sure it's written very well. And if you do want an attorney to do it, you could do that too. But always have one of these papers filled out just in case, and make sure you distribute the paperwork to all your family members that may need one, all your doctors, and people that take care of your health, okay? So number 2 on page 4 would be symptoms that indicate I need prompt medical attention. So you know yourself better than anyone else. You might be sensitive to certain medications. Put all your meds down here. If you need another piece of paper, you could attach it. You could put it on the back. See other important information regarding medications, allergies, and side effects, especially if you have issues with, latex, what they call allergies, any kind of allergies that you want prominent, put it there, okay? Some people are highly allergic to certain drugs, or some people are sensitive to medications. If you tend to be very cold after surgery or during surgery, you really get cold and you need extra blankets and stuff, all that should be written in there. I've heard of people chipping their teeth from being so cold that they were chattering their teeth and they chipped the teeth. So then B, information sharing. My current providers, all the people that could share the information. C, emergency contacts. Make sure you write down everyone's contact information, how they can be reached. And now we're on to page 5. Almost done, guys. List all your medications. You prefer these medications over other medications. And then number 2, medication authorization and refusal instructions. Make sure you write that down. The medication name or class that I do not want, and the treatment, why you take that medication. Because if you don't want like the generic, because you're used to the other medication that you know works well for you, that needs to be stated, okay? And then you might want to put down why. So number 3, D3 is additional preference about medications. You could always put down too your supplements. If you're a vitamin taker and you insist on having your vitamin C, the vitamin D3, and all that you know keeps your body in optimal health, I would put that down and make sure that it's emphatic. Because sometimes they'll say, well, there are contraindications with taking vitamins, etc., etc. So this is your mouthpiece, remember? Number 3 for D medication 3, additional preferences, and then E, Other healthcare details in general, if you want to write anything in there in general. And then 2, visitation instructions. If I am in a healthcare facility, this is how I want visitation to be handled. The more specific, the better. F, life-prolonging treatment. So you don't want treatment to prolong your life. CPR, which is cardiopulmonary resuscitation, ventilator, respirator, breathing machine, kidney dialysis, or antibiotics. Also, you could say, yes, I do not want, or yes, I do want. And then if you have, yes, I do want ventilator, but I don't want a feeding tube, whatever your specific desires are, this is the place to put it. Number 2 on this is, if my condition makes me unaware of myself and my surroundings, or I'm unable to interact with others, blah, 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 read it through and check off appropriately. So the last page, also, you know, if you're at the end and you don't want to prolong your life for another week, 2 weeks, or a month, and there's nothing more that they could do, you could do palliative care, hospice care. Put that in the paperwork, okay? It's very important. Number 3 is organ donation. I would recommend that you do your own research on organ donation. I could talk for a long time about organ donation, but there's certain things that happen when you decide that you want to be an organ donor. And I have seen funerals delayed because they had to make sure that all the organs that were being donated get harvested properly, and all the recipients of the donor organs were lined up, because the organs only have a certain shelf life time, and in order to maximize the organ harvesting, they want to make sure that everything is logistically planned out. So that might hold up harvesting the organs until all the different recipients are lined up. That could take a week. I've seen it take less, I've seen it take longer. So just be mindful that even though you are flatline, kept alive on machines, your loved ones are going to have to wait for them to harvest all the organs at their time, not your time. So just remember that. And that's all I'm going to say about the organ donation. But check it out. It's a big system. And you do save lives. And the recipients that do get organs, you know, they have to go on steroids for the rest of their lives to handle the rejection, because our body will naturally reject another person's organs and such. So you'd have to go on long-term steroids and stuff to stop the rejection process. So there's a lot that that is behind the scenes when it comes to all this. You know, we throw all this technology out there. Yeah, you could definitely be bionic, but there are little things that you should be aware of. Okay, another time. Then the last page, page 7, if I could find this, will be the signature of required signatures. So the right to revoke, affirmation, I'm signing below, the date, the signature. It shows here 2 witnesses, but if you have one, that would work, but 2 witnesses are ideal. And if you can go with a notary, that's even more sealed. But the key is to make sure that everyone has this documentation, and the more people that have it, the more likely it will be enforced, but it's not always guaranteed. Okay? So I hope this was helpful to you. Please give me a thumbs up. Let me know. Let me know if there's anything else that you want to hear. I thank you for your time. My name is Ev. And put the little bell so you could find out about the next video. And have a great day. Be safe.